So the impact of chronic inflammation on joints and connective tissues. And connective tissues are literally what they sound like. So you've got fascia going from the skin inward and then up and down and sideways and all attached to each other. That's what lets everything stay connected and move well. So connective tissue will get inflamed just like joints, just like tendons, just like ligaments. And it can happen without injury. You don't have to have an injury to get arthritis. Another common myth that I would like to dispel. So synovial cells, that's the lining of a joint. So certain joints are called synovial joints. And each joint has, think of it like a water balloon around the joint, which holds the fluid and lets the joint move smoothly. That is lined with synovial cells. The synovial cells will release interleukin-1, which is very pro-inflammatory, and they'll also recruit matrix metalloproteinases, okay? One of the treatments I do in my clinic for people is we'll inject this substance called alpha-2 macroglobulin, and that is essentially a matrix metalloprotease inhibitor, and it's miraculous the amount of pain relief it gives people. Why? Because it's attacking the foundational problem, which is inflammation in the joint. So if you can control that, you can control the pain, and then hopefully, ideally, you control disease progression. Because the MMPs are what are degrading and degenerating cartilage. And then remember what I told you, induce the inflammation and arthritis, damage cartilage will also damage synovial cells. So if you've got synovial cells producing these cytokines that bring in the matrix metalloproteinases that damage cartilage, you begin to have this vortex or this spiral that's just going nowhere good. So that we got to stop the chronic low-grade inflammation or your arthritis is not going to get better. So think of it more like a whole organ disease of the joint. It's not just a cartilage. It's a bone around the cartilage. It's the ligaments. It's a tendon. It's a joint capsule. It's the synovial cells.